Hello, everyone, and welcome to the Parkinson's Foundation's Wellness Wednesday. Psychologists, social workers, and counselors, how can they help? I'm Krista Ellis, Community Program Manager for the Florida and Gulf Coast chapters of the Parkinson's Foundation. I'm tuning in today from cold Tampa, Florida, and we warmly welcome you to the program. We'd love to know where you're tuning in from. Feel free to share your location, maybe even the temperature, to make me feel a little bit better about this cold weather here in Florida. You can type your location in the Q&A box. And just sharing, you are not alone, and your Parkinson's community is here with you today during this Wellness Wednesday. The Parkinson's Foundation will be hosting virtual events each Monday, Wednesday, and Friday of the week. To learn more and to register, please visit parkinson.org/PD Health. And Jessica and/or Danielle will share that link for you in the chat box. Let's take a look at this Q&A. Wheaton, Illinois. Welcome, Judy. Sunny San Pedro, California. Thanks for sharing, Stephanie. 33 in Minnesota. Woo! And David Kirsch, Shoreview. Thank you so much for sharing, you guys. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. I'd like to take this moment to thank Light of Day Foundation for their tremendous support. The Parkinson's Foundation provides families with free resources, including our website, parkinson.org, educational books, webinars, podcasts, a hospitalization kit, and our toll-free helpline, 1-800-4PD-INFO, which is staffed by bilingual Parkinson's specialists. To learn more about our resources and our upcoming virtual events, remember to visit our website at parkinson.org or call our helpline at 1-800-4PD-INFO. Are you interested in beginning your mindful meditation journey? Join us each Monday to practice mindfulness with your Parkinson's community. Next week, we will be exploring equanimity for the self with Devin Haase of Ashland, Oregon. Learn more and register for our Mindfulness Mondays events at PD Health at Home website, parkinson.org/PD Health. You can find that link in the chat. Next Wellness Wednesday, join our expert speakers to learn about common causes and challenges of vertigo and dizziness in Parkinson's disease. Understand what treatment options are available through your interdisciplinary care team. Again, learn more and register for next Wellness Wednesday at parkinson.org/PD Health. And now I'd like to get a little more acquainted with our web audience today. You'll see a poll come up onto your screen. And you'll take a moment just to respond to the question, have you ever gotten help from a mental health practitioner or a clinician? So this could be a counselor, a social worker, psychologist, psychiatrist. And I see people voting. Great. And thank you everyone for sharing with us today. So we have 67% of you said, yes, you have received some help from a mental health practitioner, and 33% of you say, no, we have not. So I hope after today's presentation, each of you will have a better understanding of how a mental health practitioner can support you in your journey with Parkinson's disease. And now it is my pleasure to introduce our guest speaker today, Annie Wallis. Annie is the Associate Director of Education at the Parkinson's Foundation. She completed her Master of Social Work focused in Community and Social Justice from The Ohio State University and her Bachelor of Social Work from Florida State University. Annie's primary focus is providing quality informational programs and resources for people with Parkinson's disease, their care partners, and their loved ones, and also the professionals who are part of the medical and care team. Annie, thank you so much for joining us today.
I am so delighted to be here. Thanks to all of you who joined. All right, I'm going to share my screen. Everybody can see it? I hope so. Okay. See that? Okay. So as Krista said, I am a social worker by trade and by training, although we'll talk a little bit about the different types of social workers and where I fall. I've been with the Parkinson's Foundation since 2015, and I started out as a community program manager like Krista and Jessica, who are running this program today. But I now live in Tampa, and I serve as the Associate Director of Education. And there we go. So I've got one more poll for you. I want to get a sense of who all I'm talking to. So if you are a person with Parkinson's or a care partner watching by yourself, you'll pick one of those. If you are sitting together, a person with Parkinson's and a care partner or other family member, click on that one. And if you've got any healthcare professionals or anyone else sort of in the care realm, you can pick that option. All right, I'm not seeing anything. I don't know if I should be seeing anything yet. There we go. All right. Oh, mostly healthcare professionals. How wonderful. I'm excited to be joined by my colleagues, but also a good number of people who are watching together with a loved one, person with Parkinson's, and care partner. Great. So let's get started. But before we talk about mental health, I want to talk about the care team. Parkinson's disease is so complex. And so we really want to encourage everyone managing Parkinson's to consider adding many different members to your Parkinson's care team. This team should be working together to help address physical, emotional, and mental health and wellness issues. And ideally, they'll be communicating with each other about the treatment you're receiving. This will help improve your quality of life. So when I say team, I really mean team. This is a lot of people who can potentially help you throughout your Parkinson's journey. I'm going to break this down a little bit for you, and we'll talk about everyone who should be involved, and then we'll focus a little more into the mental health realm. So first, we've got our medical providers. Think about your neurologist or movement disorder specialist, your primary care, any physician assistants or nurse practitioners and pharmacists, but also remember to think of any doctors who are treating things that are related to your Parkinson's, even if it doesn't seem quite so obvious, like a urologist or even an ophthalmologist, helping manage any vision issues around your Parkinson's disease. Next, we've got sort of our exercise and wellness professionals, our wonderful rehab therapists, speech-language pathologists, physical therapists, and occupational therapists. And then, of course, those folks who help you manage your exercise routines, which is so important for managing the physical and the mental health side of Parkinson's. And then our focus for today are folks who are focused on mental health and cognition. We are not going to focus too much on speech-language pathologists or occupational therapists today, but I did want to include them because speech pathologists do a great job addressing cognition, and occupational therapists are also trained in mental health and can work that into their approach as they work with you to optimize sort of where you live and where you work. And before we dive into the meat of the session, let's just talk a minute about why we're even talking about mental health. Most people think of Parkinson's as a movement disorder and tend to really focus on the physical pieces of Parkinson's. But the reality is mood, depression, and anxiety have the greatest impact on health status, even more than those motor impairments that are so commonly associated with Parkinson's. More than half of people with Parkinson's describe experiencing symptoms and feelings of depression. About 40% report experiencing apathy, that lack of motivation that can make it hard to do the things that you know you need to do to manage your disease. And 30% report an anxiety disorder. So this is really significant for a lot of people managing Parkinson's. And we have found that counseling plus medication, rather than just one or the other, is 25% more effective at resolving depression than medication alone. So what do we mean when we say counseling or psychotherapy? Well, psychotherapy is the treatment of mental or emotional disorders by talking. Now, this does not mean that you will be lying on the couch and talking about your childhood. It's really a partnership with a professional who can help you analyze your situation, better understand what you're dealing with, how to move forward with any new challenges that have come up, and establish new coping mechanisms so that you can live well with Parkinson's. And psychotherapy offers two advantages. There are no drug side effects, and you're going to learn coping skills that can be used long term and often will apply to things totally unrelated to your Parkinson's. And I do want to spend a little bit of time acknowledging that there are a lot of barriers to mental health care, especially for minority groups. The American Psychological Association put out a report recognizing the significant barriers that exist, especially for ethnic minorities. And we also know that compared with women, men are less likely to seek help for mental health difficulties. That's relevant for men with Parkinson's as well as male care partners. So there are a number of things that can get in the way, including racism, sexism, bias and discrimination in treatment settings, and language barriers, and quite frankly, folks just being less likely to seek treatment. So we always want to be sensitive to this, and if we've got anyone who falls into any of those groups paying attention today, I hope that we'll be able to provide some tools to help you better understand what's available to you, how to access them through these barriers. But you know, we know that this is a long-term issue, that a systemic issue that we're working to address. So who provides mental health care? This Venn diagram is a little bit scary. There's a lot of overlap. And this is the reality of mental health care. A lot of these professionals do similar things, but offer a specific perspective and special tools that some of their colleagues in the mental health space don't. And we're going to talk through all of them and really help you understand who's the right fit for what. We'll start with social workers, which is my background. As a social worker, I could help you and your family sort out and resolve issues associated with the daily demands of Parkinson's and life in general. Social workers can work with you around issues of insurance and housing, disability, and family conflict. But there's a subgroup of social workers, a group of which I am not, licensed clinical social workers, or in some states they're called licensed independent social workers. These folks not only can help with those issues that all social workers can, they can also provide psychotherapy. Some may specialize in medical social work or in serving older adults. They may have training in Parkinson's and other movement disorders. And fairly similar to licensed clinical social workers are the professions of licensed professional counselors and licensed mental health counselors. The biggest differences between these groups is a different major or focus in school, and it's different licensure. But for the most part, you're going to get pretty similar care between the three of them. And then I wanted to highlight one of our rock star social workers, Jessica Schur, who's at one of our centers of excellence in North Carolina. You can listen to her on our podcast, Substantial Matters, talking about addressing mood and coping. That's episode 38. Then we have psychologists and neuropsychologists. So psychologists work with individuals and family members to provide advice and counseling for coping with Parkinson's and other emotional stressors. So they're not necessarily, any given psychologist won't be focused in Parkinson's or in neurological issues, but there are quite a few of them, and especially if they're affiliated with a center of excellence or another medical institution that has a movement disorders clinic that has spent a lot of their time in Parkinson's and may have gotten some additional training. Neuropsychologists are psychologists who have additional expertise in how behavior and cognitive skills are related to brain structure and symptoms. Typically, neuropsychologists are more focused on psychological assessment than on the actual counseling and psychotherapy piece. However, some of them do offer counseling. And if that's the case, they really may be a great fit because they can do both. I wanted to highlight Roseanne Dobkin, who's an incredible Parkinson's-focused psychologist who is also on our podcast. Episode 84 might be my favorite episode in the podcast, where she talks about managing anxiety with Parkinson's, and she really does an incredible job of illuminating the different ways that Parkinson's, depression, and anxiety look, so you can really distinguish between the two, which can be challenging. And then finally, we've got psychiatrists and neuropsychiatrists. So psychiatrists are medical doctors, so they can prescribe medication. They specialize in the diagnosis and treatment of mental, behavioral, and emotional problems like depression and anxiety. And similar to psychologists, when you add that neuro to the front, neuropsychiatrists are psychiatrists who specialize in testing and treating mental health issues for people with disorders of the nervous system. Tongue twister there, including Parkinson's disease. And then on this slide, we've got Mark Groves, who's a psychiatrist who specializes in Parkinson's disease with another one of our centers of excellence. And you can listen to him on one of our more recent episodes. I think this came out 2 weeks ago, maybe it was last month. Time is hard to keep track of in a pandemic. But he talks about impulse control disorders, which is a really interesting piece of mental health that's tied really, really deeply to Parkinson's medications. So if you or your loved one with Parkinson's are struggling with compulsive behaviors, whether it's shopping or gambling or any other number of things, that's a great podcast to listen to, and working with a psychiatrist may be a good choice. So I wanted to be really super clear, because even as I was putting this together and thinking about, okay, let me see, how do I describe social work versus some of these other professionals? So I've created this chart for you. If you're looking for a mental health diagnosis, you probably don't want to go to a licensed mental health counselor or a licensed professional counselor. There may be some who can do this. I'll be honest with you, this is the group that I have spent the least amount of time working with in my professional career, but for the most part, that's not something that they do. They're really focused on psychotherapy. If you're looking for psychotherapy, you typically won't go to a neuropsychiatrist, a neuropsychologist, or a psychiatrist. However, some of them do offer mental health counseling and psychotherapy. If you're looking for neurological or psychological testing, your best bet is to go to a neuropsychiatrist or a neuropsychologist. And if you're looking for someone who can prescribe medication, you'll have to go to a neuropsychiatrist or a psychiatrist. I want to talk a little bit about types of psychotherapy. When we look at Parkinson's, we tend to recommend cognitive behavioral therapy. It's a very structured modality, as we call it, a structured system of delivering therapy. And because it's so structured, it's easier to study and prove effectiveness compared with other types of therapy. So it may or may not be more effective than other forms, but we know that it's really effective. So cognitive behavioral therapy is a technique that helps change thought patterns focused on negative thinking and behavior. So it helps you recognize those patterns of negative thought and speech and learn skills to help you cope better and think more positively. We've got a lot of research showing that this is effective in Parkinson's. And in fact, research has shown that it's more effective in Parkinson's the more involved that their loved one is in their treatment. Some other types of therapy are interpersonal therapy, where you'll explore relationships with other people and how you see yourself through communication analysis, role playing, and lots of other tools. And the other one that's pretty common in Parkinson's is group therapy, which involves one or more therapists treating a small group of clients together. The benefits here are that you can get perspective from others like you, and there's added social support, but you won't get as much one-on-one time to really dig deep into anything you want to focus a lot of time on. I also want to mention that therapy is not just for the person with Parkinson's. Therapy for the care partner of someone with Parkinson's might focus on role changes as Parkinson's progresses, ambiguous grief and loss around the loss of the life that could have been if your loved one hadn't gotten Parkinson's, or the loss of some of the things you used to be able to do together that you're not able to do. It may focus on mindfulness, self-care, and self-compassion, or around setting boundaries and asking for help. Care partners, please also be aware of your own symptoms of depression. It's incredibly common for everyone, totally regardless of Parkinson's. Depression, especially in this time of quarantine, is a huge problem. And it's easy to lose sight of that if you're focused on the struggles that your loved one is going through. And therapy might also be beneficial for the family. Parkinson's is a family affair. Everyone in the family can be affected. This is especially true if you still have children in the home. Children could benefit from psychotherapy if you notice anxiety around the stress of a parent's marital relationship caused by Parkinson's. If you're seeing that they're being affected by changes and losses of parent experiences or limitations of future experiences, or if they're feeling overwhelmed by caregiving responsibilities. Now, a lot of these could still be true of adult children who are not in the home, who are playing a significant role in the caregiving team, or if they're particularly close with their loved one with Parkinson's. But research has found that a child's outlook is strongly tied to that of their parent, rather. So if a parent is hopeful, often the child is too. So keep that in mind as you're managing Parkinson's as a family. So how do you find the right mental health professional? We recommend starting with your care team. If you're seeing a neurologist or a movement disorder specialist, they may be able to give you a referral to someone within the institution or to a community partner. Ideally, they would be doing that for someone who has worked with other Parkinson's patients of theirs. You can also look through your insurance provider network. That way you can make sure that you get your therapy covered by your insurance and reduce out-of-pocket costs. You can also look through the community. We always recommend Parkinson's Foundation helpline for helping find the services that you need. But you can also reach out to your support group or think local and look to your area agency on aging or your local 211, which is an information resource where they can look in their database and see what's available to you. The benefit with 211 and likely with your area agency on aging is that they'll be able to tell you if anyone can provide free services, especially if you are uninsured or underinsured, or professionals who can provide therapy on a sliding scale, where if you can't pay as much, they don't charge as much. You want to make sure that you find the right fit. You want therapy to be tailored to your individual needs. You want to feel comfortable with your therapist. And you want to find options that will work for you. All right, I'm going to take a second and take a drink of water since I'm getting tongue-tied. Another great tool for finding care near you, whether it's mental health care or really any care related to your Parkinson's, is through our website, parkinson.org/search. Here you'll be able to see any expert PD centers. So when I searched, I looked for any mental health professionals near me here in Tampa. The closest was our Center of Excellence, University of South Florida, where they have a clinical social worker. And then next is University of Florida, where they have a psychiatrist, a social worker, and a neuropsychologist. This is one way to see what may be available to you. And if anyone who's watching is a veteran, especially if you're already receiving VA medical services, you can ask your primary care provider to help you make an appointment with a VA mental health provider. The VA also has a really great TeleMental Health program, and you can connect with Dr. Weintraub, who's a geriatric psychiatrist who specializes in Parkinson's. He works through the Philadelphia PADREC, which is the Parkinson's Disease Research Education and Care Consortium. I'm really proud of myself that I remembered what that acronym stands for. He can offer initial psychiatric consult services for anyone with Parkinson's through TeleMental Health. And the VA has some other really great tools that you can look at, self-help portals and smartphone apps, and of course the VA crisis line if you need it. You can also think about counseling from home. TeleMental Health has been available for over a decade. Neuropsychological testing can be done via video. We've been able to find, the mental health world, not the Parkinson's Foundation, that it can be effective when done via video. Mental health clinicians can assess your mental health remotely, and it should be covered by insurance. And then there are also counseling apps like Talkspace or BetterHelp. These offer cool ways to engage, like through texting and video recordings, but they may or may not be covered by your insurance. I can tell you from my own experience, I have used Talkspace, and I was able to get it covered by my insurance. I had my usual $25 copay for each session, but that was much more affordable than if I didn't go through my insurance for that service. You can look to find a social worker who's been trained in Parkinson's. Our Allied Team Training Program is a course designed by the Parkinson's Foundation to increase knowledge about Parkinson's and really to focus on building capacity for interprofessional team-based care. If you call our helpline, they have a list of all of the social workers who have completed Allied Team Training. Now, I will tell you that list is not nearly as long as I would like it to be. We need to do a better job of educating more and more mental health professionals. And although we don't have tracks for all different mental health professionals, any mental health clinician can participate in Allied Team Training. We'll figure out whether it makes sense for them to be part of the social work group or the nursing group or the medical doctor group, like if it's a psychiatrist. And we'll work with them to make sure they can get continuing education. So if you haven't found someone in your area who is well educated in Parkinson's, feel free to recommend this program to them. You can also encourage them to check out our expert briefing webinars. We offer a free continuing education unit for each of those. They can call or email the Parkinson's Foundation helpline with any questions they have. They can listen and subscribe to our Substantial Matters podcast and review our educational books and our fact sheets. And we even have resources by discipline. And they can find our recommended resources for social workers to review and use in their practice at parkinson.org/socialwork. And coming soon, they'll be able to enroll in a Cognition online course. I hope that eventually we'll also have one more focused on mental health. But right now that Cognition is next in the pipeline. All right, so last question, and then we will check in and see what questions you all have. Based on this presentation, what's your plan? Are you going to talk to your doctor about your mental health concerns? Are you going to look for a counselor to provide psychotherapy? Are you going to ask about psychological testing or ask about medication therapy for your mental health concerns? Or maybe you're just going to keep these options in mind in case you need them down the road. Give it a minute. See what the pulse has. Grab another drink of water. Okay, awesome. So for the most part, you guys are going to keep these in mind in case you need them down the road. But 18% are going to look for a counselor to provide psychotherapy. I love that. And some more of you are thinking you'll talk to your doctor and ask about medication therapy. Awesome. Well, I think that's the end. So I will stop sharing and shift it back over to Krista.
Thanks, Annie. Thank you so much. I know that seeking mental health therapy, counseling can be scary sometimes to just even consider. And I just want to send some gratitude and appreciate everyone who's present here on the World Wide Web with us. So to just open up the idea of how a mental health practitioner might be able to support them in their journey through Parkinson's disease. So I sincerely appreciate you taking the time to share your knowledge and your wisdom and your resources with our community of people with Parkinson's. So we did get a couple of questions that came through, and I know once we get rolling, maybe we'll get more questions through the Q&A box. So just feel free, if you have a question when we start going through these, to submit your questions through that Q&A, and Annie and I will get to it. So Annie, the first question that's come up is, they write in, if I am already taking antidepressants, do I need to see a counselor too? Are there benefits to both?
Great question. So the short answer is there are better outcomes when you do both. Both can be beneficial if you feel like that antidepressant is managing your depression well. That's great. But it's always good to go in and learn some new coping mechanisms, because you never know when something new is going to happen that's going to throw off your routine. And it's good to have those coping mechanisms and the skills to help manage any new things that pop up ready before you need them.
Absolutely. Thank you so much. The second question, what does a counseling session look like typically, and how long is it?
So typically a counseling session will be about an hour. And in the before times, before the pandemic, you were usually sitting in a room with a therapist, sitting in a comfy chair and chatting. They may have notes in front of them. They may be sharing worksheets or activities. They may build in role play where, if you're having a particular issue with a loved one, or you're feeling like you don't know how to ask for what you need with your doctor and you want to work on that, they may, put on that hat and say, okay, we're going to pretend I'm your doctor, or okay, we're going to pretend that I'm your husband or your son who's not been paying attention to your needs, or whatever it is. And you'll actually walk through what you want to say. And in the case of cognitive behavioral therapy, it's really, really focused on helping you identify what those thought patterns are, so that you can catch them when you think, oh, my life is useless, I can't contribute in the way that I used to, saying, oh, I'm having that negative thought again. Let me challenge it. Okay, I may not be able to do what I used to, but here are the things that I can do to contribute to my family and my community. Those types of activities. Now that we are in a global pandemic, most mental health care, just like most medical care, is being delivered through telemedicine. Now, some people have their doors open, some people don't, but you may be set up on your computer doing a video call similar to this. You may be doing things over the phone with a therapist. And like I said, those the apps can create some really new and interesting ways to engage in therapy, where you can record yourself and send it, or send in your thoughts via text message, sort of just stream of consciousness throughout the day, and then have a set time to hear back from your therapist, where they can say, oh, wow, I see you texted me when you were feeling really anxious, and you were able to work through it just by saying, okay, this is what's happening. I know we've discussed that I do this, and so I'm going to do it, and wow, that worked. The nice thing with that, and that's what really worked for me, was being able to look back and see in real time, like, oh, this is what I went through between the time that we talked, last, and this next time that we connect.
So I'm hearing, a therapy session can look different to everyone. There's a lot of diversity and variety in how a therapy session might go about, and how you can receive support through a mental health practitioner, especially in today's world of COVID-19. So things are ever changing, right?
Yes, absolutely. And the other thing, and I'll give my usual plug for the social work profession as a whole. If you're in a counseling session with a social worker, we're not just going to be talking about the issues and rehearsing things, and we're also going to be weaving in any community resources, making sure if, you know, you're mentioning, oh, things are especially stressful because money's tight, you know, so my spouse lost their job or had to retire early. Social workers, more than any of the other professions, although the others do, we really focus on the person and environment perspective, and addressing all of your needs, not just the mental health needs, because it's all interconnected. So that's another piece of it as well, where if there are community resources that you can utilize, you may be discussing those in a therapy session.
And, you know, just another plug for our helpline. You can call our toll-free helpline, 1-800-4PD-INFO, and they can guide you, get you connected to a social worker, psychologist, neuropsychologist, you know, the mental health practitioner that you would prefer to see. Reach out to that helpline. We do have social workers on staff at the helpline. I've got a question here, and they write in, I'm not very happy with my current provider. Do you recommend I choose another therapist? And if so, do my mental health records transfer too?
Oh, that's a good question. So the short answer is, if you're not happy with your therapist, shop around. And I'll just say that's true with your doctors, with, you know, the rehab therapists. If you don't feel like you're getting the care that you need, look around. You may, you know, connect with other professionals and end up saying, oh, wow, I actually do really like the person I was seeing before, and go back to them. And there's nothing wrong with that. But you might find someone who's a better fit. Regarding your files being transferred, my short answer is probably not. If you transfer to another professional within the same institution, they may have access to your files and may be able to read through them before they meet with you. But if you go from one institution to another, those probably won't transfer. And so you'll have to give a little bit more background information on the front end.
Absolutely. And I'll just say, you know, having a therapist and having that person in your network, it's just like having a friend that you can talk to easily. So if you find yourself that you're not clicking, you don't have this mutual friendship, mutual support between one another, as you might with a friend, where you feel confident to share information with them, then I'll echo what Annie says, shop around, find a new therapist, dip your toe into someone new.
Yeah, well, and the other thing, as is true with anyone on your care team, Parkinson's is a chronic condition. You're going to have Parkinson's the rest of your life. And even if you wrap things up with your therapist, you meet the goals that you set at the beginning, there will probably come a time down the road where another something comes up and you need to go back to them. And ideally, you will have put in the work on the front end to find someone that you feel really good about working with, because you're going to see them periodically as the disease progresses. Again, same thing with your physical therapist, your occupational therapist, with your speech language pathologist. These should all be professionals that you're seeing fairly relatively. Maybe you go in once a year for a tune-up, even if you don't have a particularly big issue that you want to tackle. That's true with, you know, psychotherapy, and it's true with the other specialists as well. We know that your Parkinson's is going to progress. It progresses slowly for the most part, but it progresses nonetheless. So don't be afraid to go in and say, I think I'm doing fine, but let's just check in, because maybe you can help me see some ways where I can be a little more intentional about my mental health, about how I interact with people, about how I'm viewing the world as it exists now, and you know, and how things are going to look as my Parkinson's continues to progress.
And that's a really good point, you know, is this disease is with you for life. And so finding that connection with a therapist that you feel comfortable with, you know, as your disease progresses, I think is really, really, really good, good advice, Annie. So thank you for sharing that. Our next question that comes in, can a social worker prescribe mental health medication?
So the answer is typically no, but a social worker can recommend them. And then you would go to your doctor, or if you are seeing a psychiatrist, and let them know this is something that you and your social worker who's providing therapy think is worth exploring. And then that social worker, or any other mental health professional who didn't prescribe it, as you're meeting with them, can help you monitor, what's working, what isn't. Obviously, if you're having like side effects, you're not going to go to the social worker with those. You're going to go with the prescribing doctor. Talk to them about it. Say, oh, I'm feeling better, but this is happening. I'm too sleepy, or I'm feeling better, but my sex drive is totally gone, and I don't like that. But your therapist can help you sort of track whether you're feeling incrementally better, and or not, because sometimes they're not going to work.
Thanks, Annie. Let's see. The next question I have up here is, do I need to prepare myself for a first session? Are there any good questions you would recommend asking my therapist? Or maybe perhaps when you're shopping around looking for a therapist, kind of like that first consultation visit, if you will.
Yes. So I definitely recommend in that first visit that, or in that consultation, that you check in and see if they've worked with people with Parkinson's before. See if they're familiar with the disease. And if they're not, see if they have worked with other chronic illnesses, if they have background working with, folks with any other type of movement disorder or neurological condition. For the care partners who are watching, you can ask if they have, a history of working with care partners of people with chronic diseases, even if it's not specifically Parkinson's. That's a really good foundation. And if they are not familiar with Parkinson's, they don't know much, then you do probably want to ask, are you willing to do a little bit of research about how Parkinson's impacts mental health? Because if they don't know, that's going to be an issue. And you're not going to want to spend, your first 3 sessions educating them about Parkinson's disease. If they're not willing to do a little bit of reading on it, they're probably not the right fit. They should be willing to do that. And like I said, you can share resources with them. You can say, oh, visit Parkinson.org/social worker for social workers. Double check. I don't remember if there's an S on that or not. Social work. Glad I checked. Parkinson.org/social work, where they can see our mood book and our cognition book and fact sheets on depression and anxiety and apathy. We list webinars that would be worth watching, and podcasts that are worth listening to. So whatever their preferred way of learning is, we offer it. So if they're not going to do their homework, keep looking.
I think that is such appropriate advice, right? We do find in the Parkinson's world that experts in Parkinson's disease are sometimes very few and far between, especially in more rural areas. So just asking the question, what's your background in Parkinson's disease? Do you have a background? Are you willing to learn about it? And then you just hit the nail on the head. If they're not, then move on. And if they will, then maybe take the time to cultivate that relationship with that expert.
Yes, and if you do find a good therapist who understands Parkinson's, send a note to the helpline. Say, hey, I've worked with so-and-so, and they really get the disease. So put them in your file so that if other people in my area are looking for a therapist, they might end up with this one. And the other thing, I'll speak for myself here, but this is true with a lot of clinicians that I've talked to. People who start learning about Parkinson's and start working with the Parkinson's community tend to specialize in Parkinson's down the road. They tend to stay with Parkinson's because Parkinson's is a really interesting disease. The Parkinson's community is lovely and full of hope, despite this disease being so challenging. I didn't think I would stay in Parkinson's, and I've spent most of my career in Parkinson's and can't imagine doing anything else. And I've heard that from a lot of social workers. I've heard that from a lot of nurses and a lot of physical and occupational and speech language pathologists. So if you can hook a good therapist and get them interested in Parkinson's and bring them into the Parkinson's Foundation fold, get them to go through some of our training programs and help them become Parkinson's specialists, we desperately need more. And that's a way that you can get the help that you need and also give back to the Parkinson's community.
Absolutely. Yes. We're always trying to grow our database of Parkinson's experts. If you do have a therapist or find one that's especially great with people with Parkinson's, do share with our helpline. And I see Jessica put in the chat the email to our helpline. So you have the option to call and or email the helpline. So thanks, Jess, for including that. Our last question for today's event will be, let's see, here it is. Do you recommend I see a therapist alone or with my caregiver as a team?
That is a really good question. And the answer is it depends on what you're dealing with. Marriage and family therapy can be really helpful if you're having real conflict within the family. So if that's the case, if you've got some things you need to work through that may or may not be directly related to Parkinson's, then going together is a great option. If you're doing cognitive behavioral therapy, like I mentioned in the presentation, research shows that your care partner being involved is going to lead to better outcomes. So if that's the route you're going, talk to your therapist about how they should be involved. But it's also totally fine for you to get some care just for yourself, a place where you can vent a little about that loved one who maybe has the best intentions, but is suffocating you with how much help they're trying to provide, or is impatient with your apathy, and learn coping strategies to manage some of that conflict from your own end. And the same is true for the care partners listening. Really make sure, if you need time to process through the grief and the loss of life as you know it, or life as you knew it before Parkinson's, that's probably going to be better served as one-on-one counseling.
Yeah, absolutely. There's benefits to doing it alone and with your partner.
Mm-hmm.
And simultaneously, you doing a therapy session, your partner, caregiver doing a session, coming together and talking about the progress or the conversations that you've had moderated by this mental health practitioner can be extremely beneficial. So thank you, Annie, for encouraging either way.
Yeah, I'll add one more thing. Typically, if you're seeing therapists separately, not a marriage therapy session, you won't want to see the same therapist. It becomes a conflict of interest if that therapist can't remember who said what. So if you're seeing, doing one-on-one therapy and it's something you're both interested in, you'll want to find two different therapists. And if one of you is getting therapy and the other one isn't, especially if the person with Parkinson's is getting therapy and the care partner isn't going to be involved, I want to encourage the care partners to use that as some self-care time. Go get your nails done. Go for a hike. Go do something that fills your cup back up, because personal time, especially in a pandemic where we're all locked in our houses, is hard to come by. So take that opportunity and build that habit of doing something meaningful for yourself.
Thank you, Annie. Thank you so much. And with that last question and the last sentiments from Annie, we would like to conclude today's presentation. Many thanks to Annie Wallis for her time today and for sharing your wisdom and knowledge with us. And a huge applause to all of you for joining us today to learn a little bit more about some of the resources that are available to you, some of the experts that are available to you to help you along your journey with Parkinson's disease. Today's session has been recorded and will be archived on the Parkinson's Foundation's YouTube channel just within a few days, and a link will be sent to you via email following today's event. If you had a question that was not answered, please reach out to us by calling our helpline at 1-800-4-PD-INFO or emailing the helpline at helpline@parkinson.org. We thank you again for joining us today, and we hope that you'll stay connected with us. You can join us on social, visit the website, email us, call us. We'd love to hear from you. And until we can all see you all again in person, be well, stay healthy, and stay kind. Thank you, guys.